radiation is exactly based on tumor shape without using any blocks. Okay, and what is the imrt or intensity modulated radiotherapy? It is a comparison of 3D conformal radiotherapy and imrt. You see that in 3D conformal, you have flat dose profile, but in imrt, you have intensity modulation. For example, it is another comparison of 3D and imrt. In 3D conformal radiotherapy, geometrical field shaping is correct, but without any modulation of intensity. But in imrt, in lower shape, you see another color, that means different dose and different intensity. Geometrical field shaping with intensity modulation, and it is really good for treatment. imrt is a process for planning, information transfer, delivery, verification, and allows you to customize your treatment delivery based on a specific planning objective. It's another benefit in radiotherapy in imrt, intensity modulated radiation therapy, and it is another slide that shows the benefit imrt. And as you see, in 3D conformal you have forward planning, but in imrt you have inverse planning. It is really a good slide. If you want to compare 2D, 3D, and imrt, this slide is really show you the benefit of its progression. Okay, and you can compare the benefit of imrt with classic radiotherapy. In classic radiotherapy, about contouring, planning, quality assurance, and treatment time, all of them are different. It's an example of a patient that have a very huge BCC on his face, and she was treated with imrt. It is 3 months later, and she is really good now. It's in the first of treatment and the last day of treatment. Okay, and what is the difference between classic imrt versus volumetric modulated or arc therapy or vmat? In volumetric modulated arc treatment, we have short treatment time, 10 to 15 minutes versus 1 to 2 minutes. Low monitor unit, for example, 1500 versus 500 monitor units, and better dose distribution. Is short treatment time important? Yes, it is really important because of patient comfort, increase in patient number, increased time for IGRT, and less organ motion, and all of them are really important. And what is IGRT or image-guided radiotherapy that use 2D or 3D imaging, for example, cone beam CT or 2D Clu voltage imaging for better targeting? And what is brachytherapy? You see that brachytherapy can use in different types of cancer, for example, prostate, breast, head and neck, and in all of them, you can use radioactive substance that was inserted in the tumor or bed of tumor. And what is stereotactic radiosurgery or SRS, gamma knife and cyber knife radiation? Despite its name, SRS or stereotactic radiosurgery is a non-surgical procedure that delivers precisely targeted radiation at much higher doses in only a single or few treatments as compared to traditional radiation therapy. Stereotactic radiosurgery or stereotactic radiotherapy, ablation of lesions by using stereotactic methods alternative to surgery, usually used in benign lesion, single high dose, for example 18 to 25 grays, and or fractionated stereotactic radiotherapy or SRT can be used in large